what about, so if you had, a magic wand or what kind of, or wish list, what would you want to see happen? If you had no constraints and you just said, wave your magic wand, what would you hope for?
Well, for me, it starts with appropriate funding of long-term care, because it is that vicious cycle that it's not just the hourly wage, but it is to pay, a fair wage, but it is to have the staffing resources. Because then we get into that vicious cycle that it doesn't matter how much you pay someone if you're always going to be working short, and the workload itself is unmanageable, such that you don't feel the reward you should feel in healthcare, then we'll never be able to attract and retain staff. And, like, just to put it into perspective, you may have heard or read through the media this request for a minimum of 4 hours of care per resident per day. That's been asked for 20 years, and the acuity has only increased, obviously, since then. So that's getting us to where we needed to be 20 years ago. And the last thing I'll say on that, just in terms of acuity, you may recall, Amber, you're probably too young for this, but there was an amalgamation, a movement of hospitals back in the late 90s. And in Renfrew County, there were 2 hospitals in Pembroke, the Civic and the General. The Civic was closed and the General became the regional hospital. When the Civic closed and they had to transfer their chronic care hospitalized patients to long-term care, we accepted most of them at Miramichi Lodge without increasing any staffing. So, it's the difference between, I don't know, Mary Ellen, what a hospital bed is funded now, over $1,000 a day, and we're funded less than $200 a day.
Yeah. And along with that, in every sector, it's increased cost without a change to, your budget. And so you're always trying to do more with less. So that patient acuity is massive. Certainly even here, we have acute beds and complex continuing care beds. And, once upon a time, you would have rarely seen, even in my early days in long-term care, we didn't see IVs and feeding tubes, as an example. Now you see that all the time. So that has the patients have just shifted in terms of, the acuity has just grown. So you don't get admitted to hospital unless you absolutely need to be admitted to the hospital, right? Because there is pressure for that bed, just like there is pressure to discharge from the hospital into another sector, into a different level of care bed, right? Because we're all managing with not enough based on the demand. The demand has never been where it needs to be. Just like Shelley was saying, we've been asking for 4 hours of care a day per resident for 20 years. Well, we've also at the same time been asking for additional long-term care beds to manage a baby boomer generation. That's not news, but we haven't changed a thing, right?
Yeah.
So,
okay.
There's a lot of I think challenge, and sometimes I think the political schemes are just different challenges, right? You try to do the same thing without making waves, right? Because ultimately it becomes doing the best for the patient, and that's what we're here to do.
Mary Ellen, do you have a wish list? Anything additional to that?
So I would say, if that wage parity, I think, would certainly be a big thing across the sectors, so that you're not always in direct competition. I think the walls that kind of come up in terms of the sectors and the different ministries, I think we're learning and we're evolving. We're getting a little more used to, and I think Renfrew County does this extremely well, working collaboratively and well together, and trying to be innovative and breaking down some of those walls in terms of that communication and that engagement. And I think Ontario Health Teams and that type of a model is going to in some ways force a lot of that approach.
Mhm.
I think the approach, though, already in our area exists. I think, because of who we are and where we live and what we do, we already walk that talk and we understand it. But we're unfortunately maybe met with those barriers a little higher up, in terms of ministry and different challenges, challenges there. So I think, if that can evolve over time, I think that, would make retention and recruitment certainly of staff, if we can keep them in, if they want to work full-time, if we can offer them a full-time job, great. If they don't, and we can keep them employed to the extent that they want to be, then we're going to keep them in these communities, right?
Right.
Yeah.